Our next topic is debridement. So we all know what a debridement is. It is a medical cleansing of the devitalized tissues. So when we talk about debridement here, especially in these sections of codes, it is a debridement of the open wounds. While coming to debridement, please have a look at the prior sessions on anatomy because here the debridement classification is based on the exact anatomy of the skin. So we have the epidermis, dermis, and then the hypodermis, and finally you have the muscle fascia and then the bone. Same way, when the physician is going to do a debridement of a wound, you need to know to which extent the provider has debrided it. Is it at the skin level, meaning at the epidermal or the dermal level, or at the subcutaneous level, or at the muscle and its fascia level, or at the bone level? Because for all of these we have different code sets. So imagine the physician has done a debridement at the skin level. For that the code is found in the medicine section of the CPT manual because debriding at the skin level does not qualify as a surgical debridement. Okay, so only when the debridement takes place from the subcutaneous level, you can take that as a surgical debridement.